Hi, so my name is Farwa Ali, and today I will be discussing the Unit 2 case connections. So, one of the cases I decided to discuss today was case number 3, which talked about a 5-year-old boy who was brought to the pediatrician's office for his annual visit. The mother was reported the mother reported he was a sickly infant and he often was appearing drowsy. She also had concerns over her son's persistent thirst and his frequent urination. Blood samples were taken for insulin measurements at the time of 0 and 1 hour after the glucose loading test. The results of this test are illustrated in this table below over here. And this table shows that the lab report baseline blood sample of the child was 0.8, which is obviously very less compared to the normal value of 6 to -2. With 1 hour after the glucose load was given, her child is having serum insulin level of a 5, which is also very low compared to the normal level between 4 to -11. The questions that today we were asked to look at were: 1. What is this information likely to suggest about the underlying biochemical basis for the patient's symptoms? Number 2, what would you predict the patient's fasted blood glucose levels to be given his looking at his current condition? For example, would it be above the normal range, within the normal range, or below the normal range? And we also had to list 2 regulatory enzymes that are most likely to be active in the patient's current condition. The answers that I chose were the data that was given to us recommends that the basic biochemical reason for the patient's side effects could be hyperglycemia, which this implies the cells of the patient's body are not being able to take in the glucose from the blood properly because of the very low levels of the hormone insulin. In this manner, too many glucose particles are developing in the blood, which is causing the symptoms that the patient was feeling. Uh, I can predict that the patient's fasted blood glucose levels were above the normal range because the hormone insulin is barely there to do its job. And insulin's job is to help the body cells to retain glucose from the blood. Something that we all know is that the glucose is the main source of energy in our body. That's how we have energy. It's a very important compound in our body. However, looking at the case number 3, since the cells are not being able to absorb the glucose from the blood, they cannot use glucose as the source of their energy. So glucose is not one of the enzymes that is there. So we would obviously obtain energy by breaking down the fat. The enzymes that are most likely to be active are glucagon and hormone-sensitive lipase, which initiates the breakdown of fats to create energy for the baby. So another case I've looked at was case number 4, which discussed a healthy 2-month-old female presenting with jittery spells several hours after her breastfeeding. Her mother reported that she has not given the baby anything to eat other than breast milk since birth. The baby has only recently been sleeping for over 2 hours between feedings, and that's when the mother was reporting these symptoms, and that's when they all started. Laboratory results are also consistent with hypoglycemia, which is the low blood glucose, but are otherwise unremarkable. Epinephrine was also there and administered, and there was no increase in the blood glucose levels, but there was an increase in the blood lactate. The physical exam showed us that the liver edge 4 centimeters below the right costal margin. Percussion of the right chest and abdomen confirms she had an enlarged liver. Blood glucose levels were also increasing after breastfeeding, but she cannot maintain those blood glucose levels within a normal range during the fasting. The question that we were asked to look at was, based on all the information that we read, which of the following is the most likely diagnosis of this patient? We were given 4 options and we had to choose one. So A, hereditary fructose intolerance, B, galactosemia, C, glycogen storage disease or the inability to use glycogen, or D, glucose 6-phosphate dehydrogenase deficiency. So based on all the information that was given to us in this case, I can come to a conclusion that the patient was diagnosed with C, glycogen storage disease. I can say this because the symptoms that the patients showed was, number 1, an enlarged liver, which is the main symptom. Number 2, not being able to remain the normal sugar levels like she's supposed to. And number 3, the patient had high levels of lactate, which matches up with the glycogen storage disease. Epinephrine, which was also administered in there, stimulates the breakdown of the glycogen. Glycogen responds better with the liver, which the patient also showed that she had an issue with. Glycogen storage disease is a very rare hereditary disease which can occur due to the lack of the vital enzyme functioning during the breakdown of glycogen. There can be 4 different types of the glycogen storage disease. There could be type 1, type 2, type 3, and type 4. What I came across that she most likely had the type 1 glycogen storage disease because this patient does not have the enzyme needed to turn the glycogen into the glucose in the liver, so the glycogen can build up in the liver. This is what causes the enlarged liver and the low blood sugar levels, which was hypoglycemia. These symptoms can often show in babies around 3 to 4 months old. The reason for increase in blood lactate after injecting epinephrine is also due to the lack of the enzyme, which obviously breaks down glycogen from the glucose. Why all the other answer choices were not correct. 1, the answer choice, hereditary fructose intolerance, can't be correct because the symptoms of that are nausea, vomit, chronic fatigue, and sometimes diarrhea. The baby did not show any nausea or vomiting or diarrhea. The answer choice is galactosemia is also not correct because the symptoms of that are also like hereditary fructose intolerance, vomiting, and sometimes, unlike that, seizures. Lastly, glucose 6-phosphate dehydrogenase deficiency is not the correct choice because its symptoms were also, it contained dark urine, shortness of breath, and fever, which were not any of the things that the baby was feeling. All 4 of these diseases, I came to a conclusion, were very much alike. It was like 1 or 2 different symptoms that the baby was feeling, so It's very hard to see which can be the right choice, but I think the glycogen storage disease was most likely what the baby was going through. And these are my references that I used for today.